Hi, I'm Dr. Guangqian Jiang. Birth defects are developmental disorders that are present at birth. Nowadays, birth defect is a global health issue. More than 8 million children have at least one serious birth defect. Not only are they a major cause of infant mortality, but the large medical expenses also put a heavy burden on families. In the next 5 minutes, let's learn how to prevent birth defect with 3 simple measures. First, if you meet one of the following conditions, we recommend turning to genetic consultation directly. Firstly, parents already faced with 2 or more pregnancy loss. Second, children with birth defect. Third, parents or other family members presenting history of genetic condition. This is because one of the causes of birth defects are the genetic factors, including mutant genes and chromosomal abnormalities. Genetic consultation can help find causes of these defects and evaluate the risk of recurrence. For example, Fragile X syndrome is the second most common inherited disease that leads to intellectual deficiency. It is caused by an over-repeated nucleotide in the FMR1 gene. Such mutation inhibits the translation of FMR1 protein, which plays an important role in developing the neural system. Children with Fragile X syndrome often has large and protruding ears, elongated face, and high-arched palate. As they grow up, they often present with autism and social anxiety, which makes them hard to form peer relationship. Second, if you are aged over 34 years old, we recommend doing prenatal exams such as amniocentesis or NIPT. This is because chromosomal abnormality occurs with increasing maternal age. For instance, in fetuses with Down syndrome, an error called non-disjunction occurs during gametogenesis, resulting in gametes with an additional copy of chromosome 21. Patients with Down syndrome often present brachycephaly, flat nasal bridge, and upper slant to palpable features. Moreover, it is the most common inherited cause of mental deficiency. Because of the current trend of increasing maternal age, it has been estimated that within 10 years, women older than 34 years old will account for 39% of infants with Down syndrome. Currently, the incidence rate of Down syndrome is 1 per 800 infants. Prenatal examination in time is the only way to detect such disease and prevent babies from suffering. Finally, pregnant women should pay special attention to their medication and diet. Although fetuses are well protected in the uterus, some chemicals can pass through the placenta and affect the development of embryo. Such chemicals are called teratogens. To put it simply, the embryo stage of development determines its susceptibility to teratogens. For example, alcohol is one of the most toxic teratogens. During early stage of pregnancy, moderate level of alcohol intake is enough to induce symptoms such as macrocephaly, short palpable features, and congenital heart disease. Such combination of diseases is called the fetal alcohol syndrome. Currently, 1 to 2% of women at childbearing age are affected by alcohol. It is important that pregnant women prevent alcohol exposure to ensure the health of the newborn. In summary, genetic consultation, prenatal exams, and medical and diet control are the 3 key measures to prevent birth defect. All measures are equally important, as shown in fetuses with cleft lips. It is a kind of multifactorial disease where both genetic and environmental factors are the potential causes. For example, it is hypothesized that multiple genes of variable expression involved in such mechanism. Virus infection and medication may also lead to such disease. As a final reminder, fetus is arguably one of the most vulnerable stage of a person's life. Both mothers and fathers should be responsible for neonatal health and establish the correct medical knowledge of pregnancy.